Have you ever wondered how health officials keep track of diseases, ensuring communities stay healthy and safe? It is a crucial system that works behind the scenes to protect us all. Tuberculosis disease surveillance is the systematic, ongoing collection, analysis, interpretation, and dissemination of data regarding tuberculosis cases and their outcomes. Its main purpose is to monitor tuberculosis trends, identify outbreaks, evaluate prevention and control programs, and inform public health actions. This surveillance is vital because tuberculosis, or TB, is a serious infectious disease that can spread through the air when an infected person coughs or sneezes. By carefully watching where and how TB is occurring, public health authorities can understand its patterns and predict potential risks. For instance, surveillance helps identify high-risk populations or geographical areas where TB rates might be increasing, allowing for targeted interventions. It also tracks the effectiveness of treatments and identifies drug-resistant strains of TB, which requiring different and often longer treatment regimens. Without this careful watch, TB could spread undetected, leading to more illness and greater public health challenges. The data collected includes information on patient demographics, diagnosis, treatment, and whether the treatment was successful, providing a comprehensive picture of the disease's impact and control efforts. So, how does this actually work? It involves several key steps. Healthcare providers are required to report all confirmed and suspected TB cases to local and state health departments. These reports are then collected and analyzed at various levels, from local to national, often through systems like the National Electronic Disease Surveillance System, or NEDSS. Epidemiologists, who are disease detectives, review this data to spot trends, like a sudden increase in cases in a particular area or among a specific group of people. This information then guides public health actions, such as initiating contact investigations to find people who may have been exposed or adjusting prevention strategies. An insider detail to understand is the TB cascade of care. This concept helps track patients from initial diagnosis through successful treatment, highlighting where people might fall out of care. Effective surveillance provides the data needed to understand each step of this cascade, from diagnosis rates to treatment completion rates, allowing public health programs to identify and fix gaps. For example, if many patients are not completing their full treatment course, surveillance data points to a need for improved patient support or education. This granular data is what transforms raw numbers into actionable insights for public health professionals. Ultimately, tuberculosis disease surveillance is much more than just counting cases. It is a dynamic, essential tool that empowers public health to understand, respond to, and ultimately reduce the burden of TB. By systematically gathering and interpreting information, it provides the critical knowledge needed to protect communities, guide interventions, and ensure that every effort to combat tuberculosis is as effective and informed as possible, moving us closer to a world free from this disease.